Hi there, everyone. Welcome back to Amize Health, your journey to amazing health. So, this night, we're talking about maintaining the doctor patient relationship. So, I've been on this series about doctor patient relationships for the past few months now. We started off with the start of a doctor patient relationship. We went into building the doctor patient relationship, and now we're talking about maintaining it. And if you guys want me to review a little bit of the previous topics, I'm happy to do that. But in terms of what we talked about this month in regard to maintaining a relationship, I talked a lot about, with maintaining any form of relationship, it takes work from both parties. There's expectations on both sides. And so, I like to think of the doctor patient relationship in the context of every other relationship that we have our part as healthcare professionals. I have my role to do, I have my part to do, and as a patient, you have your part to do. So, just to review over the things that we talked about when it comes to maintaining the doctor patient relationship, we talked about making sure that you're keeping your appointments, you're going to your follow up appointments, you're scheduling your annual physical, you're getting your lab tests done when they're ordered. And if your therapy isn't working, you let your doctor know that so that they can make the adjustments that are necessary. So that's what we talked about in the first week. I'm going to pause for a second and just say thank you guys for joining me tonight. I'm so happy to have you on. I'm excited that we're having this conversation because the doctor patient relationship, it's one that is near and dear to my heart. And I thought that it would be a good thing for us to actually go back to the basics about how we build and maintain these relationships. So that's why I'm talking about these things. So for those of you who feel like I already know this, I still implore you to join and participate and send questions because it'll help those of us that don't. And so if you don't have the information and want the information, I'm happy to provide that for you. And if you feel like I'm talking about something that you may know something about already, I'm still thrilled if you'll join me because there's always something to be learned and I'm not excluded from that. Okay. So, that first week, like I said, we talked about keeping your appointments, communicating with your doctor when therapy is not working. So, in week two, we started talking about like my chart messages and respecting each other's time. And, one of those things that I think comes up a lot, for, at least as a primary care physician, I've gotten messages that were sent all hours of the night. And, sometimes those messages are followed up with additional messages. So, in one night, if you send a My Chart message three times, I think that it's an unrealistic expectation that I'm going to respond to your message that you sent at midnight, at 2 a.m., and then at 4 a.m. Right? Especially when it's something trivial. So, I got to get some sleep too. Look, your doctor got to sleep too. How else are we going to function? So we're not on our My Chart messages, check-in messages in the middle of the night. So I think whether it's something more important or something trivial, I don't think that's really the appropriate time. Now, if you're just sending something and you're like, you know what, I'm just going to send this now because I don't want to forget about it, that's fine. But just understand that My Chart messages, number one, it's not for emergencies, right? Number two, once you send that message, give your doctor, your provider time to respond to that message. They don't have the expectation that you're going to get a message back within the next 5 minutes. I know that we're in the time of social media and people responding to us with the quickness, but we're still professionals here, right? And so we're going to get back to you during our business hours or during our work time. So please be respectful of that time. And then, so that's what we talked about in week two. And in week three, we went on ahead and I started talking about what I call the give me what I want mentality. And, that's just the patient that comes in and just says, oh, I want this. I want Izithro. I want, this is the medicine I want. And I have to always backtrack and say, well, ma'am, sir, what symptoms are you having? Let's start there. Like, explain to me what it is that's going on. Not, I just want a Z pack, because I'm not going to just prescribe you a Z pack. I don't even know what you want it for. You didn't explain anything to me. So let's start off with telling me what your symptoms are, allowing me to examine you, and coming to the determination whether or not that Z pack is even necessary. So this is one of those situations where I mentioned, stop trying to treat the doctor's office like a drive-through restaurant. And I really mean that, because a lot of us go into the doctor's office with Dr. Google having already told us what we should get. And so we go in there and say, this is what I want. Well, the truth of the matter is, no one, not myself, not any other medical provider, none of us are obligated to write the script that you are demanding. So instead of getting upset when we don't, I think you should slow down, explain what it is that's going on, and allow that doctor to make the conclusion that is necessary. Sometimes that conclusion may be very much in line with what you were asking for, but in my experience, oftentimes it's not. So please give us the opportunity to evaluate you, to listen to what's going on, and to treat you adequately and appropriately, instead of coming in and demanding things and then getting upset when you don't get exactly what you want, when you want the way you want it. So again, I know that that's the society we live in right now, but I implore you, please don't do that to your doctor. It's really frustrating. And at the end of the day, just like I mentioned about being respectful of each other's time, we're all human beings too. We don't want to be spoken to in any kind of way in a disrespectful manner. If you are on your job, you expect people to be respectful towards you, right? So I just ask that when you go into the doctor's office, whether it be the front desk staff, whether it be the nursing staff or the provider staff, please be respectful. Stop just coming and demanding things, because it may not go the way that you're expecting it to. Okay, so those are the things that we talked about in terms of maintaining that relationship. Because when you think about it in the context of a relationship, when you're in a relationship with someone, whether it be a friendship or an like intimate partner type of relationship, how does it work when you demand things from them? I bet that it don't always come across the way you think it is going to, right? So just like you can't demand things from people in your other relationships, please don't carry that over into what is supposed to be a professional relationship. Okay? So that's the thing. Those are the things that we talked about. And I'm so happy again to have you guys on with me tonight. So I'm going to go ahead and start taking questions. And I see that we already have someone that's posted some things here. So let me just go ahead and read it to you. It says, sometimes I want to share my concerns with my doctor, but my chart is not convenient for me. I'm free at nights, so that's when I usually remember. Are there other ways to reach out besides my chart? Now, yes, my chart tends to be the most convenient way for a lot of people, because most people have access to a cell phone, so you have the app, you can just sign in to, I say my chart, but whatever version of online messaging that your doctor's office may have. So that tends to be very easy for people, because it really can be done at any time of the day or night. It's just that, like I mentioned before, those messages are not being checked at nighttime. So don't have the expectation that you're going to get a response during the night. However, the person is saying, I'm free at night, so that's when I usually remember. I actually would just recommend writing down that question. Like, most phones will have a memo pad on it or something like that. Just start, like, a memo of all the questions that you want to ask your doctor, so that either at your next appointment, you can bring them up at that time. Or if you want to call into your doctor's office, most doctor's office will have nursing staff that does what we call triaging. And that's basically to determine whether or not the issue that you're bringing up is appropriate for needing to be seen right away versus needing to be seen in the next week versus, oh, you can wait for your next appointment. So if it's something that you're concerned about, you jot it down. You can always call the doctor's office and speak to the nurse's line or the nurse on staff and determine whether or not it's something that you need to be seen for more urgently. But for most people, my chart seems to be, or like I said, whatever version of messaging software your doctor's office uses tends to be most convenient for people. Okay, I hope that answered that question. So again, I'm Dr. Thorpe Amize. I'm taking any questions that you guys have about the maintaining the doctor-patient relationship. And because this is the end of us talking about the doctor-patient relationship for now, you can ask me any question about the start of the doctor-patient relationship, building it, or maintaining it, because I'm all about the relationship, right? I love having a good relationship with my patients, especially my primary care patients, because that was a big part of the reason why I went into medicine. It's because I loved the people that I would interact with, and I like being able to be there to educate, to answer the questions that you guys have. So if you have questions, go ahead, send them into me on the comments below. If you're not logged into YouTube, in order to send me a message, you can send me a message on any of my social media platforms at Amize Health, and that's on LinkedIn, Facebook, TikTok, and Twitter. Okay, so you guys can send me any questions that you have there. So I'm going to pause to kind of check to see whether or not people have been sending in messages so that I don't miss anything. And I cannot stress it enough how happy I am to have you guys here. So we're talking about doctor-patient relationships, which are so critical. And I think that sometimes, we do kind of forget that the doctor or the provider is not just there to fulfill our every demand, but we are here to take care of what is actually one of the most precious things to you, your health. You may not always think about it that way, but I certainly do, because at the end of the day, if you are not in good health, and if you are not taking care of yourself, what good are you going to be to your family? How are you going to be capable of performing your job, your duties, to the best of your ability? And how are you going to stick around or live long enough to see your children grow up or your grandchildren get born and grow? So at the end of the day, all of this is to ensure that we're really living in our best, most amazing lives, right? So any additional questions that you guys have, please send them over to me. Again, if you have the ability to text me, you can text me questions that way, or you can send them in on any of my social media platforms. So I'm going to continue going. One of the things that I talked about before was about how important it is for not just for patients to be honest to the doctor or to the provider, but also for me as a clinician, to be honest towards my patient. Sometimes that honesty is not well received, and those of you who do that, you know who you are. Sometimes it's not well received, but I do try to the best of my ability to deliver information in a way that it should be received or could be received well. And I do try to make sure that I am compassionate in the way that I deal with people, because you never know where people are in their lives at the time. They may be coming into the office for one thing, but there's so many things going on in the background that's impacting the issue that they're coming in for. And so I do try to be mindful of that when I'm talking to people. But I brought up the fact that we have to be honest with each other, because that was what I started off with as the basis of the doctor-patient relationship is really honesty. And part of that honesty, and I wanted to touch on this, part of that honesty is how we introduce ourselves and appropriately introducing ourselves. So as a MD, trained physician, like a medical doctor, and someone who is a DO, trained physician, introducing themselves as Dr. So and so is completely appropriate. Now, there are other types of clinicians, and some of them provide care similarly to trained MDs and DOs. And I think that, for instance, there's physician assistants, there's nurse practitioners, and some people will go on to get a PhD, and so they're called Dr. So and so. But in a clinical setting, introducing yourself as Dr. So and so is only appropriate when you have an MD or a DO. And I know that this is one of those things that everybody won't agree with me on, and that's okay, because we're all entitled to our opinions. But if you are not trained as such, you really should be introducing yourself as, if you want to say, oh, I'm Dr. James, like, let's say I'm Dr. James NP. That's more appropriate, because why? Because that's letting that person know that you are actually a nurse practitioner that has a doctorate. That's an appropriate way to introduce that, rather than just saying I'm Dr. So and so, because you're basically allowing people to believe that you are a medical doctor, or a DO, okay, a doctor of osteopathic medicine. So I just wanted to touch on the importance of how we introduce ourselves, so that you guys know as patients who you're dealing with. I will tell you that even when I go in to see a doctor, a specialist, whatever the case may be, I've been introduced that way, like, oh, I'm Dr. So and so, and only to find out not only didn't they didn't have a doctorate of any form, no PhD, no MD, no DO. They didn't have a doctorate of any form, but they just introduced themselves as that. That's actually misrepresentation. That's not okay. So, I, from our perspective, from the clinician's perspective, we really need to be introducing ourselves appropriately. And then from the patient's perspective, it's okay for you to ask. It's okay for you to check who you're dealing with. It's okay for you to say, to find out who it is that is treating you, because again, one of the most precious things to you is your health. And we want to make sure that we're taking care of you appropriately, with the utmost respect. And I think, like I said, honesty goes a long way. We start off being honest with you about who we are. At least I do. My expectation is that you're going to be honest with me about your health, your medications, your family history, basically all the things that go into my taking care of you. So those things are very important, and that is really a major part of our relationship, our doctor patient relationship. So let me see if any of you have any questions regarding that. I would be happy to take any additional questions about that. Thank you guys again for joining me tonight. I know that some of the topics, and some of you guys may not agree with my point of view. And if you don't, again, that's okay, because we're all entitled to our opinions and our points of view. But message me, let me know what you're thinking, because maybe you'll open my eyes to something. Or if my point of view is just very different from yours, I'll explain more about why I have the point of view that I do. I'm happy to have those conversations. Okay, so send me a message, send me a DM, let me know what you're thinking. I'm happy to have you guys on as we continue the conversation about doctor patient relationships. I cannot stress how critical these conversations are. So, the other things that we talked about, aside from honesty, aside from being respectful of each other's time, keeping our appointment times, um, not demanding things from your doctor, we also talked about um, misinformation, and getting information from sources that may not be the most trusted sources. So I implore you to make sure you are vetting the people that you're getting information from. Just like, and I am no different, I'm not excluded from that. So if you say, okay, who's this Dr. Thorpe Mize? I don't know you. um are your credentials actually right? What you can do is go ahead and type my name into Google, because you all love to use Google. I do too. Type my name into Google, put that MD afterwards, and my information will pop up. Now, if you have someone out there that's giving you information and you Google them and you can't find them except for on their website and for on their social media, and there are no reputable sources of information about them, there's no medical board information about them, then you know that this is not a trusted source. So just vet the sources that you're getting your information from, because it's not always the best information that you're getting. And again, we are in the information age because everything is on the internet now. So you can really just go look up whatever you want to look up. So just be cautious of all the advice that you're getting from different sources that may not be reputable. Okay. And then I wanted to say to be consistent in telling us what you're coming in for. Sometimes people don't feel comfortable, and I have patients do that all the time. They may not feel comfortable telling the nurse something or telling them the nurse what they're coming in for, but when I go into the room, they're like, "Actually, doc, this is what I'm here for. I just didn't want to tell them because, this is, it's about my privates," or whatever the case may be. you know the nurses, the medical assistants, they are professional staff also. And so it is their job to find out the information from you about why you're coming in. So please share, please be consistent in telling us what you're coming in for, what the issues are that you're dealing with, because we're happy to address them appropriately. Okay, so that's pretty much the summary of all that we've been talking about over the past 3 months. And this is really the conclusion of how we start, build, and maintain doctor patient relationships. Again, this is something that I want us to continue to work on. I hear patients say it all the time, especially older patients. Going to the doctor is not what it used to be. I don't even know my doctor anymore. Every time I get comfortable with one, they leave and go somewhere else and start, start a different practice or start with somebody else. So part of I can't say why your doctor may have left where they left. I can't tell you specifics about or address specific scenarios, but what I can say is these things that I'm talking about goes a long way to building a relationship with your doctor and having your doctor get to know you in such a way that when you come into the office, they know who you are, they know what's going on with you, and are happy to see you. Because let's truth be told, we're not happy to see everybody that walks through the door. We do it because it's our jobs, but we're not happy to see everybody. And that's just the real of it. We're all people, right? We're all human beings. So I have a question here. With the lack of doctors recently, do you think more doctors are getting overwhelmed? Absolutely. That is absolutely true. And part of that is some of the, I touched on one of them before, which is like the MyChart messages. Because let's say we are having to see more and more patients per day, right? So many of us go seeing so many patients. We don't barely get a lunch break, barely get a bathroom break. We're just going and going and going and going. And then after you go and go and go and go, then you have to do notes. And then we have all these MyChart messages to respond to. So if every patient sends messages, and if it does, think about it, it would become overwhelming. Many of you, let's say, being a doctor aside, many of you in this climate are overwhelmed with the jobs and responsibilities that you have in your current job. And a lot of that stems from how things have unfolded since COVID and the decrease in the amount of staff that is in any particular job, right? and the demands or more work that's placed on you. So if you are one of those people, you understand what it is to be overwhelmed, and physicians, clinicians are no different. So that is why I'm saying absolutely, we get overwhelmed too. And then it says, could this cause them not to care as much due to the workload and time constraint? That's also very, very true. Because if you think about it, if you are operating from a place of being a place of fatigue and tiredness, you're not operating in your best self. So the doctor that, or the clinician that would usually be super friendly, or that would usually be a certain way, caring and compassionate and all of that, it's not to say that they won't be those things anymore, but the more overwhelmed and the more exhausted or the more burnt out they get, the harder it is for them to continue to maintain those good positive qualities that they usually have, because they're exhausted. So it absolutely can cause them to not care as much about the job, because a lot, I will say, a lot more now people view it as a job instead of a calling. Before, it used to be, there was a time when it was like, okay, this is what I feel I'm called to do. This is, being a doctor, meant more than just showing up to a job to do a job and then getting off when you get off. And I think that's partly why people have viewed doctors over the years as practically like martyrs for the cause. Like, you're expected to be doing everything all the time and be available all the time, because there was a time when doctors did that, right? When they had private practices in small towns and they were the only one around, so they were available at all times for all people. Well, things aren't like that anymore. And, I do think we are in a different time now. The workload is more, the expectations is more. So we do get overwhelmed like everyone else. And then when you consider the fact that with COVID, we had many physicians and clinicians who passed away, that we lost because of it. There's also the fact that we lost so many, then there's some that left the workforce. And so the amount of work or the amount of expectations then get piled onto those who are left to overwhelm them even more. So absolutely, it can cause them to get burnt out. And then this person mentioned about time constraints, and there are time constraints on the appointments, because if you work for what we call corporate medicine at this point, they cut the amount of time that we have to see each patient. So then the amount of patients per day is much higher, and the amount of time that we have per patient is less. So if you are a complex patient, which, when I say complex, meaning having multiple medical problems that need to be addressed, or maybe you're not a complex patient with multiple medical problems, but you have a lot of things or a lot of questions that you want answered, and you want someone to spend the time with you, we may not necessarily have the kind of time that we previously spent or that we want to spend. It's not that we want to push you off, it's not that we want to just move on. Sometimes that's just what happens, because that's the position that we're in. So this person asking these questions, you are absolutely hitting the nail on the head, because doctors are getting burnt out because of the fact that the where we are right now, there's just more work, less clinicians, and it is a challenge. It is a challenge. But I will say, I still think of this as, many of us, it's not that we want to be burnt out, it's not that we don't want to do the job. We still very much care about our patients and do the best for our patients to the best of our ability. So many of us still do that. And I'm so thankful for our physician workforce, our clinician workforce, that continue to go to work every day and take care of our patients, because it's not something that we have to do. But thank God for all the people who make the decision that this is what they're going to do, and that they're still going to go do it with a level of compassion that patients can feel, and that they're still going to keep doing it with the same rigor, or try to do it with the same rigor that they had when they first went into medical school. So, I do think that, you know, most of us are really just doing our best. So sometimes, just like when I mentioned earlier, that when I see patients, I try to take into consideration the things that may be going on in the background of that patient. I just want you all as patients to remember that we too are human beings, and there may be a slew of things going on in the background of what, of for in our personal lives and in our professional lives. And we really try very hard to not allow that to bleed over into our interactions with you. But just as much as we try to extend grace to you as a patient, please extend grace to your doctor or your clinician also. Okay? So the next question is, considering the current situation, could nurses or other medical staff be trained to help out? Yes, I think that that's already something that's been happening. And I think, though, that what we need to recognize is that each person in medicine has their own role, right? So to the expectation that medical staff or nurses are going to do more, it would lead to their burnout also. So, in a way, that's already happening, because there are many nurses now that are becoming nurse practitioners. And so they begin to see patients in the capacity of a treating clinician. So it is happening. However, there are nursing shortages also now, right? So to answer the question, you're putting more on other parts of the workforce, in essence, where they may also already be burning out, because just like as a physician, I'm dealing with having to see more patients per day, right? That's more patients per day for the medical assistant to work up and get vitals on. And that's more patients per day for the nurse to have to deal with also, right? With whether it be vaccines or whatever, or given medications or whatever the case may be. So we are all having to do more. So I do not think that the answer is to still ask them to do even more. I think that we need to be training people to come into medicine. We need to be encouraging more people to get involved in medicine, more people to become medical assistants, more people to become nurses, more people to become physicians. So, so I don't necessarily think that putting more stress on people who are already there is really the answer. But again, that's my opinion, right? So I know you guys have yours too. I'm more than happy to hear them if you want to share. So, thus far, we've talked about a lot tonight in a short period of time. And I'm so glad that you all were able to join me for this. So, I think I'm going to wrap up now. I'm going to see if I have any more questions on any of my social media platforms. But other than that, I think I am going to just go ahead and start wrapping up. So, if you have any questions, please go ahead and send them in to me at Amize Health, whether it be on LinkedIn, on Twitter, on Instagram, on Facebook, or on TikTok. I'm happy to answer your questions. So I'm going to go ahead and check now to see if I am missing any of your questions. And we will be starting a new set of topics for the first Monday in November, but we are going to continue to have the fourth Monday Q&A session. There may not be one in December, but we'll let you know for sure. So fourth Mondays, we'll do another Q&A. Starting in November, we'll have new questions or new topics. And if you have any particular topic that you want to hear more about, I'm happy to answer questions for you. I'm happy to start addressing things that you guys want to hear more about. So just definitely send me a message and let me know that that's the case, and I'll be happy to start tackling that for you. And in the meantime, I'll go ahead and put some things out there. So I'm so happy that we were able to answer some of these questions. We went through some difficult topics tonight. And again, I know that some of the things that I say or I talk about are not the popular opinion. And everyone is entitled to their opinions. And again, I'm happy to have conversation with you all about where we are in medicine now, about building relationships in medicine, about how we can improve healthcare delivery. Those are all topics that are important to me, but we can talk about those things, or we can talk about actual medical diseases or medical problems. So just send me messages, comments, let me know what you guys are thinking, let me know what you guys want to hear about, and I'm happy to have those conversations. It was so good to have you guys on. So, I'm so grateful for the questions that's been asked tonight, and I think I'm going to just give it another minute to see if there's any additional questions um, that I can answer for you guys. So like I said, this has all been about building the doctor patient relationship. If you guys any of you that are listening to this have a speaking engagement that you would like to have me speak at, definitely send me a DM or let me know, send me a message in the comments, let me know how I can get back in touch with you, and we can go ahead and see whether or not we can schedule something. Okay, it's definitely been a good time talking with you guys about these topics. So here's another one that just came through. I don't know if anyone asked this, but what would you recommend when choosing or switching doctors? I know they are ratings, but what else should I look out for? So, you know, I I like word of mouth. That's me. And the reason why I say that is because sometimes with the ratings, excuse me, you can go by ratings. You can. But the reason why I caution people with ratings, especially like ratings on Google and things like that, sometimes when someone goes to an office and gets upset about something, they go on Google and put whatever their negative ratings or negative interaction is, and a lot of times that negative interaction is not even with the doctor or with the clinician. It's actually sometimes it's something that's completely unrelated to the provider, the doctor, the NP, the PA. It's sometimes completely unrelated to the care that they provided. However, the rating is there and reflects poorly on that clinician. So um I would say, yes, you can read ratings, especially when there's a lot of positive ratings on one particular person. That that speaks volumes. But when there are negative comments, sometimes, you know they're just not very reflective of the person. So I like to talk to people that I know to make recommendations to me. So if I know you and you're telling me that Dr. So and so is really good, I'm going to trust your opinion more than I would random people on online, right? So I would use that. But let's say that I'm in a new place, I don't know anyone, so I don't have anyone that I can ask, then absolutely yes, you can look for ratings. Now, when you look at the ratings, so this person is asking, what would I recommend when choosing or switching doctors? When you look at the ratings, what things are important to you? And look to see if those things are being mentioned in those comments. So if you are looking for someone who's personable, then you see if that thing is being mentioned about that doctor that you're considering. If you're looking for someone who's thorough, see if that's being mentioned. Sometimes people don't care about thorough, they just want quick. Look and see if that's something that's being mentioned, because sometimes being thorough goes hand in hand with somebody being upset because it wasn't fast enough. So some people don't care about being thorough, they care about getting out quickly. So so it's sometimes a trade-off. So I would, if you're going to go based on ratings, I would look at the types of comments that are being made about that person to determine, or about that practice to determine whether or not they're someone you want to see. Now, let's say that you book an appointment and you went in and you're like, I don't really think that this person is for me. Not every personality matches. Look, just like I was mentioning before about doctor-patient relationships, with any relationship, you're not in relationship with every single person, right? Sometimes the personality just doesn't work for you. And that's okay because there's other doctors around. So if you go into an appointment and you selected a new doctor and based on your insurance, let's say it wasn't based on ratings, wasn't based on anyone telling you, but like let's say you just pick someone at random because they're covered under your insurance, and you get in there and you're like, I tried, but this isn't working for me. It's okay to then switch and try someone else. Just again, if you're using ratings, look for comments about the types of things that you value and that you find that are important. Because what may work for one person may not work for the next. So just be cautious with that. And then, like I said, asking for word of mouth. I hope that answered the question. And I think that that was the last question that we had come up. So again, I know I say it a lot, but I'm so grateful to have you guys on here. I'm so grateful for you listening. Thank you for supporting. Continue to support, continue to watch. I really, truly appreciate each and every one of you, because this is something that I value so much. Educating people, especially people in our community, about how to go about navigating their healthcare and the healthcare system, because it's not always easy. I'm going to tell you, even as a physician, depending on what it is I'm trying to do, even for me, it's not always easy. So, for someone who is not well versed or well educated, it can be a challenge. And a big part of why I do this is to help you in that process so that you can get to living your best, amazing life. So, thank you so much. Thank you. Continue to follow me on Amaze Health, on platforms on social media. Like I mentioned before, we're on Facebook, we're on LinkedIn, we are on Twitter, we are, here on YouTube, and we are on TikTok. So follow me on any or all of those platforms, okay? Thank you so much for joining me tonight. I look forward to our next conversation, fourth Monday, 8 p.m., right back here on Amaze Health Live. Okay? Have a good one. Thank you for joining. Take care. Bye bye.